We should have scientific guidelines that are not corrupted by industry that tell Americans the truth.
Make America healthy again. It's a movement, and it's here to fight the power. MAHA's leader in Washington is HHS Secretary Robert F. Kennedy Jr. His movement is made up of granola moms, health gurus, gym bros, and regular concerned Americans. And he's now in control of one of Washington's most powerful bureaucracies, the Department of Health and Human Services.
We're seeing an explosion in cancers in this country. We're seeing an explosion in infertility. Girls are now reaching puberty 6 years earlier than they're supposed to. Other countries are not experiencing this.
One of his co-pilots is Calley Means. He's the best-selling co-author of the book Good Energy, a former lobbyist for food and pharma, and a current special government employee at Kennedy's side. Means has done a lot of thinking, and if you're on the Joe Rogan circuit, a lot of talking too, about how the Trump administration can confront exploding chronic disease in America. One part of that plan is to take on some of the nation's most powerful industries, the food, pharmaceutical, and healthcare companies he thinks are keeping Americans sick.
The problem isn't the Medicare-Medicaid policy. I'm not talking about that. I'm talking about what's the logic that oversees Medicare and Medicaid. What's the clinical logic? Right now, the clinical logic is that if a kid has high cholesterol, statin. If a kid is sad, SSRI. If a kid is obese, Ozempic. That's the treadmill that we're on.
I talked to Means on Wednesday at Politico's healthcare summit to get to the heart of what MAHA is and what exactly he and Secretary Kennedy want to change about Washington. I'm Dasha Burns, and this is Playbook Deep Dive. So walk me through. We just talked about all of your different titles and achievements. What is it that you do exactly?
I mean, for me, it's just a microcosm of what has brought Bobby. It really made him today, according to Gallup, the most popular politician in America. I think there's a lot of forces behind him. But I came to this issue in 2021. It all came together. My mom abruptly had a pain in her stomach, went to the hospital, got a scan, got a text, said she had stage 4 pancreatic cancer, and died 12 days later. And this really solidified the mission for me. My sister left medical education and surgical residency after seeing inside the system, seeing the corruption of the system. I was a lobbyist early in my career, grew up in DC for food and pharma. And watching my mom in those 12 days, the medical system was telling her the cancer was unlucky, but it wasn't. She was on 5 medications over 40 years, the statin, the metformin, the ACE inhibitor for high blood pressure. Each step along her journey was a pill, this is just a symptom instead of explaining what's happening inside her body. So it really propelled my sister and me to think about, this is happening to everybody. We're missing the warning signs. 95% of medical spending is on, really managing conditions, not preventing or reversing it. And that's leading to deadly things. Life expectancy is declining in the United States for the most sustained degree in American history. So my sister and I wrote a book, went on podcasts. Those podcast hosts introduced us to the President Trump's campaign. Bobby Kennedy was able to help foster that connection after the Butler shooting and stayed close. So started a company, wrote a book in this space, and have joined as a special government employee to help with this MAHA agenda. We've got 50 items on the list. 50 items on the list that pull it above 80%. I think Bobby is really marshaling these voters behind him, and this independent media system and this grassroots. He comes into this cabinet position with more legitimacy from voters behind him than any cabinet secretary in modern American history. And I'm just dead focused on helping him just be successful with policy after policy that gives leverage and voice to the millions of voters that I think came to the Republican side to back up his agenda.
So I don't know that we have time to get through all 50 items that you mentioned, but now that the MAHA revolution has been swept into power, what is success for you? Can you define what success is in terms of policy? At a minimum, what do you want to achieve in the next 4 years?
I think this is really important. There's a lot of stakeholders in this room, and I think a lot of questions about Secretary Kennedy. I think we should all just understand what he's trying to do and what the Trump administration is trying to do, which is that in 50 years, the history books look back on this moment as the time the chronic disease crisis started to reverse. Right now, 38% of teens have prediabetes, 50% of teens are overweight or obese. We have, out of 212 countries, ranked the highest cancer rates of any country in the world, developing or developed. We spend 4 times more per capita on healthcare than Italy, live 7 years less. We're not lazier than Italians. There's something wrong with our system. So fundamentally, what we're building towards is a world where hospitals are incentivized for beds to be empty, not full, where pharmaceutical companies are incentivized to be creating therapeutics that reverse and prevent the disease, promote longevity, not just manage disease, where insurance companies are incentivized to promote health, not as they are today based on the medical loss ratio issues, really incentivized for people to get sicker, costs to go up. There's a fundamental incentive problem in our healthcare system, and we're trying to start the conversation, I think, of something we can all agree where we have a healthcare system that promotes disease reversal and prevention. How we get there, and I think what the strategy is we start doing very popular things, start working with stakeholders to build towards that goal we can all agree with by focusing on issues like transparency, like conflict of interest reduction, like benefit flexibility, and some core concepts that the administration's talked about. But we got to start getting wins.
Well, right now, it seems like the first priority has actually been to make a lot of cuts. This week, there's news of massive cuts to HHS. At this point, about a quarter of HHS's 82,000 employees have left or are expected to be terminated. So just some of the changes here. You've laid off big chunks of offices in charge of vaccine and drug research, HIV/AIDS research, AI, funding for services for the elderly and low-income people, STD prevention, rural health, with very little lead time.
Right.
What do you say to people in the public who are concerned now about drug safety, about whether we're prepared for the next pandemic when these cuts have happened so hard, so fast?
Yeah, I'd say to the reporters in the room and the lobbyists in the room, I mean, obviously make your case, but I'd truly ask for, as you're making it, a little bit of humility about what the voters were trying to say by putting Bobby Kennedy Jr. in this position of power. I would a little bit of humility to ask why Bobby Kennedy, along with President Trump, are the two most popular political figures in America by far. What the voters are trying to say, and I think they were right, is that the system is really on the wrong track. That the existing health authorities just demonstrably, the NIH oversaw, and this is just consensus at this point, the literal creation of a pandemic. The NIH, whose goal is to promote American health, has overseen a devastation, just an abject devastation in American health over the past 20 years, with disease rates skyrocketing in America, leading the world of almost every single chronic disease, with rates of nearly every single chronic disease being at an all-time high among kids. There's been very little innovation with small pharma, with innovative therapeutics at the FDA. It costs $1 billion to get through the process. CMS is an agency that's much larger budget than Defense Department, that's controlled by the American Medical Association, which is a pharmaceutical lobbying group and is almost predominantly sick care. So there's real problems. And when you turn on CNBC, it's just a nonstop. It's a nonstop infomercial for pharma. It's a Sky Rizzy commercial followed by Scott Gottlieb saying how Bobby's killing people, followed by a breathless coverage of the measles outbreak and no mention of
the mental health crisis. How does cutting a bunch of HHS solve that problem?
It is insane. It is insane for you to insinuate that the thing standing between us and better health is more government bureaucrats. Like that's not what I meant.
That's not what I'm insinuating.
That is what everyone's saying. It is absolutely insane to insinuate that it's some crime.
It's not all bureaucrats. It's a lot of scientists. It's researchers. It's people who are making sure that
those scientists fundamentally have overseen, just demonstrably, a record of utter failure. It would be insane. Is that funny? Is that not true? I'd love to hear how, so what metrics would you guys point to for how the scientific community, how the 4 times more per capita on healthcare spending that we spend in America versus other countries has produced innovation? Has there been one single chronic disease medication in modern American history that has lowered rates of the chronic disease? It is appropriate that the American Academy of Pediatrics right now, which is 90% funded by pharma, is pushing Ozempic on 6-year-olds.
So Calley,
that is what the medical authorities are doing.
Why not then use the power that you guys have to push the existing infrastructure in that direction instead of slashing it altogether?
It's not slashing. It's taking it back to 2017 levels. That's not slashing. The amount of bureaucrats.
It's more like 2002 levels, actually.
In many cases, it's actually just not that much. But it is cutting, what is it, 20,000 people? It's taking it back to, it's taking the HHS back to 68,000 employees. It is absolutely, like the idea that Bobby Kennedy should not come in and make dramatic changes to the leadership and the personnel at these authorities that have overseen an abject devastation of American health, which the lobbyists in this room do not have the humility to admit that we have gone completely wrong. The lobbyists in this room laughing when we have the sickest children in the developed world. If you guys if that is your attitude, and your attitude is to tell the MAHA moms that their votes and their voice is not legitimate, that we need dramatic changes to American healthcare, if you think it is illegitimate for Bobby Kennedy to not make big changes to people like Peter Marks, who once again and again went against FDA advisory opinions, who fired the two top vaccine makers, the two top vaccine scientists at the FDA for suggesting that we shouldn't mandate COVID shots for soldiers, who continually went against expert opinion in favor of the pharmaceutical industry, who many people here were collaborating with him with. The fact that somebody like that can't be fired and he can't install tremendous people like Marty Makary and Jay Bhattacharya and Dr. Oz to start reforming these agencies and put in their people, of course he should do that. That's what people voted for.
So I think the question, though, is a lot of dynamic
lobbyists,
responses.
A lot of people that profit from kids being sick.
But let me ask you this, Calley. Like, there's the shifting of the ideology, right, of people who are in HHS to line up more with RFK Jr.'s vision for the agency. But the way that these cuts have been made, like, I think there are a lot of people who agree with the taking away some of the bureaucracy and the red tape in government, right? But when people who are working on projects that are critical to people's health are walking into their offices and suddenly can't get in, can't finish the projects, can't do the proper transition to the new folks who are coming in. Like, was that responsible and humane too to the people that have dedicated their lives to this cause?
We are at I don't think we're understanding what the voters are trying. We are at an existential moment in American history right now. Like we have the sickest children in the developed world. We're at a genocidal.
Are going to execute on this agenda.
Dasha, you can paint breathless stories with anecdotes all the time. Fundamentally, what Bobby has done is taken over a department that has utterly failed. The CMS in and of itself has a much larger budget than the Defense Department. You know, on Medicaid, it's growing 2 times faster than the defense budget and larger, just Medicare and Medicaid alone. And as that spending happens at a higher and higher rate, kids are getting more and more sick. Like at the NIH,
do you want to see cuts to Medicare
at the NIH, 90% of NIH funding goes to studying pharmaceutical R&D treatments to profit the pharmaceutical industry off the fact that Americans are already sick. Very little NIH funding right now goes to actually core research about why we're getting sick, about foundational scientific research. The FDA completely boxes out any innovation. It's a tool for large companies to get their large drugs approved, very little pathways for new therapeutics, AI therapeutics, therapeutics that actually can help you diagnose and understand what's going on inside your body and be more preventive.
Well, so let's go with this premise, though.
These institutions are broken. Yeah. You should. Why aren't you asking about how we can reform these?
Well, I am. That's my question. So you come in, you're getting rid of the fat. You're trimming the fat, right? Is that's the premise for you guys. So how do you then, from there, you've come in, you've cut a bunch of people. How do you then actually move and turn the ship toward what you're talking about?
Are you going to install Marty Makary, who is the first FDA commissioner in the past 3 decades who said he's not going to go to a pharma job right afterwards, as 11 of the 12 previous FDA commissioners have done. You install Jay Bhattacharya, who is the pinnacle of academic courage. You install Dr. Oz, who is an incredible human being who's put together an incredible team who's ready to reform. People that are ready to engage with industries. People that are ready to talk about improvements in chronic disease prevention, in deregulation, in transparency, in conflict reduction. You put incredible people in charge who are universally respected, and you empower them to fulfill Bobby Kennedy's mandate, get win after win after win of making this administration the time when we said enough to the skyrocketing chronic disease crisis. That's what you do. Any business in the world, if you went into it with the metrics that the HHS has overseen, with skyrocketing costs, and as costs skyrocket, worse and worse outcomes. With extremely little innovation from industry on actual chronic disease reversal and prevention, just management, you would of course fire a bunch of people. And you would of course install new leadership to put that mantle down. And this is a group that wants to work with industry, but is absolutely defiantly saying we need a new direction.
Let's talk about food, because that is an area of expertise for you. Look, becoming healthier can be expensive. Right now in America, getting food that is better for you costs more, and it is such a barrier for lower income Americans that also have the worst health outcomes. So how are you planning to bring down the cost of being healthier in America?
Yeah, one thing Bobby Kennedy is not going to do is entertain comments from food industry lobbyists using food prices as an excuse to continue poisoning children. Like, that's not going to work. And I know a lot of you guys are doing that. And I think if you really back up, that's an evil argument. That's the only argument the food industry is making. Right now, they're trying to hold a gun on food prices to literally not even dispute the premise that Americans are being poisoned. We have 10,000 chemicals in our food that are not allowed in any other country. Fundamentally, American food companies make their food with different ingredients than other countries. I mean, the food dyes is obvious because it's been a flashpoint. American companies are making their products here with crude oil-derived food dyes and making the exact same product shipped into Canada with beet juice and carrot juice. So I think when this starts, Bobby's going to, and Secretary Kennedy's going to first talk about transparency, and that's what he's done. He's talked about GRAS standards. Fundamentally, what he's asking for is we need to understand what's in our food. The FDA currently does not have a list of what's in our food. They do not have a list. It's self-policing. So he's going to work with the NIH, work with the FDA to have a list of what is in our food and have post-market review of those chemicals. There's a lot of lobbying to actually prevent even transparency about what's in their food. There's voracious lobbying from industry about preventing, that's going to embarrass us. That's going to make us look bad. We, at the baseline, what Bobby Kennedy's saying on food is we need to know what's in it. We have to have accurate science on the chemicals in our food.
So you're talking about holding corporations accountable, making them be transparent. President Trump is a pro-business president. He wants to deregulate. He wants it easier, to make it easier for businesses to basically, do whatever they need to do for their bottom line. How does that jive, and how much has he empowered Secretary Kennedy to try to regulate some of these companies?
President Trump is the defining figure of our time politically because he stands for anti-corruption. The MAGA movement stands for combating the swamp against whose interests are against the American people. So what President Trump and Secretary Kennedy do not stand for is things like the food stamp program, SNAP, the number one item going to soda and subsidizing soda. It doesn't stand for the food industry being able to self-police and have less healthy chemicals in our food. It doesn't have, stand for, frankly, a system that has really incentivized and recommended ultra-processed food. The USDA guidelines under Biden recommend sugar to 2-year-olds. It actually said recently, just a year ago, that a diet 93% in ultra-processed food for a child can be healthy. So what President Trump and Secretary Kennedy have talked about, it's not pro-business, anti-business, it's anti-corruption. We should have scientific guidelines that are not corrupted by industry that tell Americans the truth. We should have transparency for American consumers and lawmakers of what is in our food. We should start with transparency and the truth. That's what President Trump did with his executive order on the MAHA commission, which is not going to talk about policy. It's just going to lay out the truth of why kids are the sickest in the world, something that lobbyists here are hissing at, something that lobbyists here, for some reason, have no self-awareness or humility for the state of American children's health. President Trump is standing with the voters, and he's like, at the one baseline, the first step of MAHA is acknowledging the truth so we can all make decisions and get to a place we probably all agree with, which is a system that reverses and prevents disease, a system that gives patients more autonomy and choice over their healthcare decisions.
So has President Trump given Secretary Kennedy the leeway to say, go to town on these corporate interests if it means making Americans healthier?
I don't think it's go to town on corporate interests. I think it's let's get Americans the truth. I mean, it's just not clinically accurate, for a 12-year-old who is struggling with their weight to be told that obesity is a genetic condition, they should go on Ozempic for life. It's not clinically accurate to tell a 12-year-old who's a little bit sad that they're, the standard of care should be going on SSRI for their entire life. SSRI prescriptions have doubled among high schoolers.
Right.
That's not like that is what clinically the American Medical Association is saying and is filtering through our Medicare and Medicaid codes. What MAHA is trying to do there's obviously going to be a lot of work and a lot of lobbying on the Medicare, Medicaid reimbursement rates, but there's something fundamentally, and I think everyone can agree, fundamentally broken with the incentives of our healthcare systems. Clearly, that's the case when you look at the graphs about what we spend versus our outcomes.
But a big piece of that is corporate interests, right?
I don't know what you mean by
I mean, companies that sell junk food wanting to...
I think President Trump and Secretary Kennedy say if your corporate interests are profiting from children being sick, you should be worried. Your corporate interests need to be preventing and reversing disease for the American people. But I don't see it in this framework. Nobody talks about in this framework. President Trump and Bobby Kennedy never talk about it.
You've said these companies are poisoning kids.
No, I'm saying these companies are profiting from the American children being sick, which is a demonstrable statement of economic fact.
Right. So that means that Kennedy will be potentially going after some of these, making them change what they are doing.
Well, there's a clear voter mandate to have a healthcare system that reverses and prevents disease. I want to be really clear.
Yeah.
I don't see Secretary Kennedy being vengeful or really anti-corporation in any degree. I think there's actually a feeling that this is a group effort, what's happened in the past 40 years. I think most people in this room would agree. There is not a finger pointing happening right now. There is not backwards looking retribution. There is a moment we all have in America right now to acknowledge that we have a problem and acknowledge that problem is multifaceted. That problem is because of $1 trillion of agriculture incentives over the past decade that have led to an ultra-processed food system, that have led to American children, 70% of their diet being ultra-processed food when it's 10% in Japan. It's not right. That's because of incentives. They're not pointing a finger at industry. This is a group effort that's happened. It is a extremely complex group.
How do you get industry on board, though?
Everyone can agree with the goal of having healthier kids. I think everyone can agree with the 10-year goal of having a system that reverses and prevents disease. Everyone can agree in 10 years, it's going to be very complicated to get there. We have a thriving healthcare sector, which is making a lot of money by promoting disease reversal and prevention and longevity for the American people. Everyone can agree with that. Now, there's thousands of steps to get there. What I would say to industry is, what can we do to start getting wins right now? There's a lot of great communication that's happening with industry right now. There's hospitals that want to promote more value-based systems, want to promote a system where they're paid when patients are healthy. There's, many interests that want to see more healthcare flexibility, take advantage of and support Bobby Kennedy when he said, let's get Medicare and Medicaid not to a top-down system where you jab certain pills down kids' throats who are sick, but actually have a system where there's more HSA type accounts for Medicare and Medicaid, where a mom with their kid who's depressed and obese, could take the pills, but also get that kid on a functional medicine program, get more blood tests.
So the idea is to expand access to different kinds of treatments via Medicare and Medicaid?
A two big principle Secretary Kennedy's talked about, it's let's get patients the right information, let's get gold star science, and then let's trust the American people to make the best decision with their doctor. We actually very much have a top-down system right now with Medicare, Medicaid, private insurance, which is really beholden to medical codes that are sick care codes. It is get American patients the truth. Let's have transparency. I think there's a lot of interest in this room that would like more transparency. There's pharmaceutical companies that feel like they have great data and actually want that data to be out there more. So it's transparency. It's asking fearless questions. It's being led by Jay Bhattacharya, who represents that more than anyone. We're not going to be afraid to give American patients the truth. The truth, by the way, which is really prevented often by lobbyists of the truth getting out because it could be embarrassing to industry. But it's not about backwards looking. I want to make that really clear. This is a group effort where we are. It is about looking forward, not reclamations to the past, and having the truth about what our standard of care in America could be, and then letting patients make the right decision. This is not top-down, kind of mindset of dictating the American patient, eats broccoli and exercises all the time. It's giving Americans choice and steering that $5 trillion nearly that we spend on healthcare to how do we incentivize prevention and reversal, not just management.
The access is a big part of that. I mean, let's talk about SNAP for a second. You all are suggesting that SNAP benefits not cover soda, right?
Yes.
What about the flip side of that? How do you make healthier foods more accessible? Because right now, for a lot of SNAP, people who are on SNAP, those stores that they're going to, it is mostly soda and junk food.
Well, I disagree fully with the premise that it's going to hurt kids to take away soda from SNAP. Just fundamentally.
That's not the premise that.
Okay.
That's not what I'm asking. I'm asking, are you also thinking about the flip side of how to make health, not just taking away, but also making healthier food more accessible?
Bobby Kennedy stood with the governor of West Virginia, who submitted innovative waivers on work requirements on taking soda off SNAP, and he explicitly encouraged governors to come to him for waivers. There are now governors speaking to him about actually innovative waivers to increase funding if you steer it to healthy food. There's a lot of state latitude with SNAP. It's a great example of a state.
Can you use that model nationally? Is that something that you would?
Bobby Kennedy is encouraging every single governor, and he's talking to red and blue governors, to call him to work with Secretary Brooke Rollins, who's tied at the hip with him on this. And they're encouraging state innovation, which can include both taking objectionable food, clearly objectionable food, off of SNAP. A lot of lobbyists here it's just unbelievable. They're arguing that it's important for childhood nutrition to have government subsidized soda. That ship has sailed. We're encouraging every single governor to take soda off of SNAP and bring innovative ideas of how to incentivize or potentially even bring more money to healthy food. Absolutely, SNAP should be a program that is supplemental nutrition. There's a ton of latitude that state governors have, and we are encouraging every single governor. This is an unimpeachable issue. Work with the USDA, work with Secretary Kennedy on innovative arrangements, and the federal government is open for business to discuss these waivers, which can include both the incentive side and taking off injections.
Yeah, so on the federal government side, I mean, you talked about all of these 50 items that you guys want to get through over the next 4 years. Going back to the accessibility of healthy food piece, I mean, can you talk about any specific plans you guys have to make it easier for especially low-income Americans to build healthier habits and have access to healthy foods? I mean, right now, so many people live in food deserts. People don't have the ability to afford better food.
Well, the food deserts, I'd argue, are largely an invention of SNAP. I mean, this is a large program. This is a $120 billion program. It's the fourth largest entitlement program. This is a huge distorter of, worldwide agriculture incentives. The fact that 60 to 7% of SNAP goes to ultra-processed food when no other country in the universe.
But again, my fundamental question: how do you get people there? How do you get?
If you take soda and healthy food, soda and unhealthy food off of SNAP, foundationally, economically, that opens up tens of billions of dollars of more money to healthier food, which then correct the food desert issue, because the food deserts are there because the majority of their money go to SNAP, and SNAP goes to ultra-processed food. Secondly, when we talk about the two prisons of MAHA, about let's get American patients the truth and then have flexibility, foundationally, and Bobby said this defiantly last week, food is medicine. We spend $4.9 trillion now on healthcare. 90+% of healthcare costs go to foodborne illnesses, essentially, go to chronic disease, which are interconnected. The medical system said diabetes, obesity, dementia, other conditions are siloed conditions, which we need different pills for, different NIH institutes. These are all interconnected conditions. So when we talk about healthcare flexibility, when we talk about giving Americans, more control of their healthcare, that does get to a system where we drive healthcare dollars to the clinically best intervention for that disease. It is demonstrable clinically that often these diseases are food related. So when you talk about the lobbyists here trying to jab Ozempic into the arm of 30% of 6-year-olds, right? I would argue clinically, maybe sometimes Ozempic's warranted. Maybe it's not an anti-drug situation, but often that 6-year-old needs better food. Often that 6-year-old needs to drive healthcare dollars to a diet coach, to some functional medicine blood tests to understand their nutrient deficiencies. And yes, have some medical incentives to food as medicine. That's what we're talking about with healthcare flexibility. The long-term goal of this administration is to have science, and Jay Bhattacharya said this very clearly. He wants to understand the root cause of disease, which often goes to food, and then have the medical dollars go to the most efficacious way to prevent and reverse that disease. And if that turns out from the research increasingly to be food interventions or root cause interventions, then it would stand to reason, like in Europe, where if a woman has PCOS, she gets a insurance subsidized keto diet because PCOS is insulin resistance, which doctors don't learn here, and can be reversed in 12 weeks, often with a keto diet instead of jabbing that woman with hormone pills.
That means funding, though. So do you want to keep the money for
$4.9 trillion
for Medicare and Medicaid steady, or do you want to see cuts to Medicare and Medicaid?
What does this have to do with cutting Medicare and Medicaid? I'm saying Medicare, nobody disagrees that Medicare and Medicaid should be going to the most efficacious treatments to reverse and prevent the diseases Americans have. Nobody would agree with that. The problem isn't the Medicare and Medicaid policy. I'm not talking about that. I'm talking about what's the logic that oversees Medicare and Medicaid. What's the clinical logic? Right now, the clinical logic is that if a kid has high cholesterol, statin. If a kid is sad, SSRI. If a kid is obese, Ozempic. That's the treadmill that we're on. 35% of teens are on a chronic disease medication, and the chronic disease rates are skyrocketing.
What is the policy solution to that, though?
Have better NIH research that identifies what's causing and what can prevent or reverse disease.
So the cuts to NIH research, will they be restored then? Because you need money to do that kind of research.
The Medicare and Medicaid is driven by scientific inquiry that sets the standard of care. Right now, the standard of care is wrong. The standard of care is led by the AMA. Medicare and Medicaid is only as good as the logic that underlies it. How to solve that, how to create more efficacious treatments and more food as medicine. You have NIH research that shows what's causing disease. We have very little research on how food and lifestyle interventions relate to disease. You have more FDA approval pathways for root cause therapeutics, for preventative scans and treatments. And then you have better FDA deregulation at the FDA, more NIH research about how root cause lifestyle interventions impact disease. That folds into standards of care that underlie the payouts for insurance.
But Calley, I'm not questioning that piece. I'm questioning how you do all of that research and work when you're slashing it and cutting.
We're not. Has NIH funding been slashed?
Yes.
No. Has research has not been cut.
The funding has been cut.
Research funding has not been cut. The NIH now has the indirect funding. Indirect funding does not. Indirect funding. It's amazing. It's amazing how many people here care about the health of American children. I'm actually inspired. Thank you for the care. Thank you for the care. The administration has put out guidance that they want to direct and cut indirect funding. That fundamentally means more money is going to researchers. The guidance that Bobby Kennedy and the Trump administration put out means more money is going to frontline researchers to do research. There is a very clear signal, demonstrably, with what is happening, which is that government bureaucrats are being disempowered and more money is going to actual researchers. They are hissing about changes to a system that has caused absolute devastation to American health, about policies that give more money. Today, more money will be flowing to actual researchers, not university bureaucrats, not government bureaucrats, actual researchers. Not a dollar of services has been cut. There has been an attack on bureaucracy, both with the indirect funding because of the NIH, not money. Harvard was getting 70 cents on the dollar, not for research with a grant, but for bureaucracy. Cutting indirect costs gets more money to researchers. People can believe this or not. There is a absolute fixation in this administration on empowering researchers, on getting money to scientists and not telling them what the answer should be, not telling them what to study, asking them to do bold research on why we're getting sick.
I actually do understand that. It's the friends that I have and the people that I know that are in research. Unfortunately, there are bureaucracies at these institutions as well. And when you cut funding, it does end up trickling.
The rank and file researchers are very excited about what's happening.
So let me ask you.
The pharma lobbyists are not.
I will tell you I know researchers who are very, very concerned, but let's see how this plays out. I do want to ask, because I have to let you go, but there's been a lot of concern about the measles outbreak. Secretary Kennedy received some criticism because he was not really out front on this issue, and people are wondering why.
Well, the media can write, I think, process stories about Bobby Kennedy taking over the largest department in government and different operational issues. But I think Bobby Kennedy is very concerned about the measles outbreak, and the administration is committed to the best possible responses from the CDC. And he's getting his team together. There's a absolute commitment to best in class infectious disease responses. I would also say that it's interesting to me that the level of reporting on one measles death and the utter lack of interest in this room and in the media, quite frankly, about the 38% of teens who have prediabetes and the hundreds of millions of Americans that are being savaged by
Well,
chronic
I think
disease.
we've talked about that actually quite a bit in this conversation,
I think
which
it's been
I do
very little
appreciate.
talked about generally, and I think that there is a huge commitment to get the measles outbreak under control and have best-in-class response to that. But
why did it
is
take
very
so long
interesting.
for Americans to hear from the Secretary of Health and Human Services in the midst of a real crisis?
I mean, in his first week, I think he put a statement out and responded quickly. I can't talk to the process of the couple days. And
why hasn't HHS been out front saying, get vaccinated, make sure we're preventing this disease?
I think they've made very clear statements on that.
All right, Calley, my time is almost up. I just want to ask again, big picture, stepping back, the vision. How is American healthcare different 4 years from now?
The NIH has been shifted to asking, how can we understand what's causing American sickness? 80% of the NIH budget is going to true innovations to reverse and prevent disease, not figuring out how to manage disease. The FDA is much more deregulated, is encouraging innovation from therapeutic makers, from preventative device makers. We've overseen the true inflection point for AI and technology and how it can help prevent and reverse disease at the FDA. We've ridded the FDA of conflicts of interest, which are an absolute scandal. And that work has led the CMS department to work with Medicare, Medicaid, and private insurance to evolve the standard of care towards the science, which is that we are being hobbled by an interconnected set of lifestyle conditions that our medical system currently does not incentivize reversal and prevention techniques for. And the CDC has best-in-class infectious disease procedures while also focusing more on their remit to prevent and reverse chronic disease, which is an area they have completely ignored thus far. So we have foundationally a system where everyone in this room who thinks Bobby Kennedy is crazy in 4 years is thinking a little bit more about disease reversal and prevention, that Bobby is gone and that the paradigm, because of the will of the voters, has been shifted just slightly to where in 4 years, 8 years, you guys can still talk about how Bobby was a whack job, but we're talking about more prevention and reversal, and we're not fundamentally having a healthcare system that, just as a statement of fact, is predicated on more people and more Americans being sick, which is what we have now.
I will say I don't remember another time in history when there has been this much talk in politics about chronic disease, about childhood disease.
No thanks to a lot of lobbyists in this room, but we're very glad the American voters have pushed that forward.
I hope we can keep the conversation going. Thank you guys. Appreciate it.